in adolescent.
Thank you Mr. Chairman. بحب أشكر الأستاذ دكتور سيد عبد الحميد والأستاذ دكتور حمدي تمام على الدعوة الكريمة. التوبيك بتاع النهارده على Tibialis Posterior Reconstruction after excision of Accessory navicular. Accessory navicular, it is an extraossical medial to the mother navicular bone. The tendon of the tibialis posterior inserts in this bone and all tarsal bone plantarly except the talus. It's usually asymptomatic. It arises from a separate ossification center which ossifies at the age of 9 to 11 years. It's occurring about 10% of population, appear in adolescent, more in females, 70% is bilateral. GIST 1914 classification still applicable up till now. It classified accessory navicular into 3 types. Type 1, it's about 5 millimeter sesamoid bone in the tendon of the tibialis posterior. It's separated from the mother navicular by about 5 millimeter. It is smooth. It is arise due to shear between the tendon and the navicular bone. It's usually asymptomatic. It occurs in 30% of cases of accessory navicular, the only one which recur after excision. This type 1, as we mentioned. Type 2, it is the commonest type. It occurs in about 55% of accessory navicular. It's about, it is heart-shaped or triangular. It's separated from the mother navicular by 2 millimeter of hyaline or fibrocartilage. It's usually asymptomatic, but sometimes give medial side foot pain. Type 2, accessory navicular. It usually ossifies and give type 3, which is prominent navicular bone. Sometimes give pain due to friction between the large navicular and the shoes. Type 3, accessory navicular. CT of type 3. The 3 types, type 1, sesamoid bone, 2, it's heart or triangular in shape, separated, about 2 millimeter hyaline cartilage, and type 3. Presentation of accessory navicular usually occur in type 2. It's about pain in the medial side of the foot. Once pain occurs, we can call it accessory navicular syndrome. It usually occurs after history of an injury. This injury leads to separation of the synchondrosis, the cartilage fusion between the accessory navicular and the navicular bone. And the force of tibialis posterior prevent healing of this separation. It gives pain due to stresses. It occurs in adolescent and in middle-aged people, usually females, due to tibialis posterior insufficiency and flat foot. X-ray, it will show widening of the synchondrosis, irregularity, sclerosis, and sometimes ossifieds. Widening of the synchondrosis. Ultrasound, we will see the irregularity of the synchondrosis, sometimes fluid due to shear force around the tibialis posterior tendon. MRI also give us edema at the accessory navicular and the medial side of the navicular, will show us the status of the tibialis posterior tendon, can show fluid around the tendon or around the synchondrosis. Irregularity and sclerosis also can appear. MRI, widening, irregularity, edema at the accessory navicular and medial side of the navicular bone. Treatment, either conservative or surgical conservative treatment, non-steroidal steroid injection in the tendon, immobilization, cast immobilization, flat foot bracing to relieve tension from the tibialis posterior, physiotherapy in the form of stretching and strengthening exercises للبرونياي والtibialis posterior tendon and the intrinsic muscle of the foot. Sometimes in type 2 or the accessory navicular syndrome, a conservative treatment we will get no improvement, so we refer to surgical treatment. There is a lot of types of surgery to reinsert the tendon of the tibialis posterior in the navicular. I try, as we all know, the hypothesis of bone-to-bone union. I try debridement and putting a screw, but the pull-out strength of this screw is weak and it will loosen. Direct separation of tendon of tibialis posterior and direct insertion, reinsertion through drill holes in the navicular, also not satisfactory, but reinsertion with anchors. And the most important step, leaving the tendon still attached to the distal insertion in the other tarsal bones. You leave the tendon distally, what you call it as modified Kindler procedure. Through transverse incision centered over the accessory navicular from the distal to the tip of the medial malleolus to the medial cuneiform. The landmark is the tibialis posterior tendon. We must expose the tendon, and we will separate the periosteum and the insertion of the tibialis posterior as dorsal 1/3 and plantar 2/3, going parallel to the upper part of the tendon, going strictly subperiosteal to separate the tendon attachment from the accessory navicular. This is the photo of the accessory navicular and the medial part of the navicular bone. We excise the accessory navicular and part from the medial side of the navicular going parallel to the medial cuneiform. Excised part of accessory navicular and medial side of the navicular. Going to insertion of the anchors from the medial side of the navicular. The sutures from the anchor with two stitches, one proximal and one distal, to do over-tightening the tendon of the tibialis posterior, putting the foot in maximum inversion and plantar flexion to tighten the tendon. Tightening of the sutures, and finally we close the tendon and the remaining periosteum dorsally. The final. This is the patient with type 2 painful accessory navicular. We start with the left, it's bilateral, it's female, 13 years old. We start with the left, the most painful, and we did the procedure. We will notice changes will happen, not only the improvement of pain, changes in the arch, in the male's ankle, talo first metatarsal ankle, calcaneal pitch ankle, and the navicular height, without doing anything more to improve the arch. Post-operative photo, we did the left, the right side is still, as we see the prominent navicular in the right side, and the absence of prominence in the left side. Video will not occur. مش هيبين لنا حاجه غير ان هو satisfaction of the patients بعد ما عملت الناحيه الشمال وانها عايزه تعمل الناحيه اليمين، ودي صوره الناحيه اليمين بري اند بوست اوبراتيف. ممكن ناخد بالنا ان كل الميجرمنتس قلنا عليها اللي هو الميرز انكل، قلت له فيرست ميتاتارسال انكل، النافيكولار هايت، الكالكينيال بيتش انجل، كله اتحسن في الصوره اللي هي بوست اوبراتيف. Modified Kindler procedure is a good way to manage painful type 2 accessory navicular. Okay, thank you.
Thank you, Dr. Professor Ahmed. يعني